Hello and welcome to Olympic Connect's first tips and tricks video. My name is Jacqueline Plant and I'm a community program coordinator with Olympic Community of Health. Today I'll be walking through some tips and tricks for navigating the regional resource directory. All right, so before jumping into it, this is a brief overview of what I'll be going over today. First, a quick intro on our regional resource directory, both the version in C2C and the version on our website. Some strategies for searching through the directory and locating appropriate resources and services, utilizing the saved filters functionality in C2C, and lastly, sharing resources with Olympic Connect clients. All right, so first for a little resource directory overview. So when we're talking about the resource directory, I'm talking about the resource directory that is located in Connect2 Coordinator or C2C. This version of the resource directory is of course accessible to C2C users only. It's not available to the public. This resource directory is updated almost every day. And I think it's safe to think of this as kind of the master version of the resource directory. The other version of the resource directory is the version that is located on the Olympic Connect website. So I'm on olympicconnect.org right now. And at the top, you can see there's a link here for the resource directory. And you can also find that same C2C resource directory published here on our website. So it obviously looks a little bit different because it's just formatted for the website, but this is a copy of the directory that's in C2C. The only really big difference between the two directories is that this one is updated monthly and not every day. So if you suggest a resource and it's added to the resource directory in C2C, you may not see it on our website for a few more weeks because we just copy it over once a month. And then as a reminder, this version of the resource directory is viewable and accessible to anyone. All right, so let's start searching for some services in the resource directory. So first things first, to start, there are two filters that you always want to use regardless of what it is you're looking for. So the first is resource status, and that should be set to active. So that's right here, see if I can highlight it. This is typically auto-populated when you first open up the resource directory, but definitely be sure to double check. It's really important that that's always there. The next thing is the submitting organization, which is right here. And that should be set to Olympic Community of Health. So as a reminder, there are other hubs that use C2C in the resource directory. So it's shared by all of us. By selecting OCH as a submitting org, you'll be shown resources and services that are specific to our region and then have been vetted by our team and suggested by you. Okay, so now that we have those two filters set, next you can start applying other filters one by one, and it's always recommended to really just try to use as few filters as possible, just to be sure that you're not unintentionally over-filtering and missing out on appropriate resources. So what you want to do is start by searching for the actual service that you're looking for with geography and location excluded. And so that means using one of three categories, either the service name, the service categories, or the organization field. So just to kind of go over what these are all for, the service name, which is right here, that's the name of a specific program that's offered by an organization. So for example, Parent-Child Assistance Program or PCAP that's offered by First Step. So First Step is the organization, PCAP would be the service name. Other ways that it's used is kind of as more of a general label for the service being provided. So you might see things in there like dental services, supported housing, things like that. Those are just labels for an organization that might offer several different services and programs. Lastly, sometimes you'll see the name of the organization repeated here. So we'll put them in there that way. Maybe if the organization really only offers one service and they're kind of one and the same, or if the resource directory listing is more general. So an example of that is Olympic Peninsula YMCA. we have in there as an organization, and we have several different resources and services listed in there that are offered by the YMCA, but there's also a listing in there where the service name is Olympic Peninsula YMCA, and that's just meant to be like a general listing for the YMCA. Okay, and that field is a type-in field, so you kind of have to know what it is that you're looking for. So if you know what the specific service name is, then great, type it in there. But otherwise, the other categories might be a little bit easier to browse. So the next one is service categories, and this is the category of the specific service or program. The big caveat with this one is that when we're entering resources into the resource directory, we're limited to only one category per service, which is very limiting and changes the way that you might search for things. The good thing though, however, is that you can search with multiple categories. So would definitely encourage you to kind of think outside the box a little bit, consider the type of service that you're looking for and also the demographic of the client that you're working with. So maybe it's some kind of transportation service and aging and disability services. There's a big veterans category in there, so think about that and select as many categories as you think that the service you're looking for might fall under. You'll notice that when you start typing in this field or you click into the drop down, there's a drop down here where there's category headers as well as subcategories. And what's kind of nice about this field is that you're able to click the main category header, which will then select all of the subcategories beneath it. This is a great way to cover your bases when you're not really sure, and you can always exit out of filters that you know or categories that you know it definitely isn't. But I use that feature a lot. Last thing I'm going to point out here is organization. And this is right here, categories was right here. Organization is the name of the organization that offers the program or service. So this one is another drop-down menu where you're able to select multiple organizations. So what I usually do with this one is I'll start typing, and sometimes you might see that there are what look like duplicate entries or they're very similar entries. And in that instance, I would definitely suggest that you select anything that looks like it might be relevant. An example of that, earlier today, I noticed that there's an entry in there for fish line and then North Kitsap fish line. So I selected both just to be safe. It can't hurt to put more in there. Okay, and then one more just piece of advice that I wanted to point out with the service categories is when in doubt, or just as a general rule of thumb, I think it's a great idea to just take a look at what we have for financial, what is it called? Financial assistance services. So many of our clients are looking for financial assistance of some kind. Maybe it's utilities or rental assistance or childcare or vouchers or gas vouchers, whatever it is. And a lot of those are categorized under those specific categories. But some of them are just in this general financial assistance bucket. So even if you can't find exactly what it is that your client is looking for, it's worth taking a look through here because you might find something that could really help them out. Something that they haven't even asked for, but that could provide a little bit of financial relief and maybe free them up for some other things. So again, what I just did what I kind of mentioned before, where I just selected the service category main category rather than going through here and trying to select everything that might apply. I'm just going to hit that bold one, and then it pulls up all of these different financial assistance categories. So this might be just something that you just kind of familiarize yourself with. Wireless assistance for mobile phones, birthday fairy for a family that might have young kids, housing, children's holiday help. There's a lot of different things in here. So just might be worthwhile to take a look at, and you might be able to offer something to your client that they hadn't thought to ask for and you maybe didn't know about. All right, so earlier I mentioned holding off on the location or geography filters. And the reason for that is, again, to avoid overfiltering and missing out on good resources. However, there are many resources where location really matters, and maybe you're seeing a lot of results in your initial search and you'd like to pare it down a little bit. by services that are, in closest proximity to your client. Things like routine healthcare, dental services, childcare. For those, the location is really important. So if that's the case, use the county field, which is right here, county served. So we do our best to tag every resource entry to county. So this is definitely the safest bet. Many resources are not city or zip specific. So by using a city or zip filter, you'll likely end up filtering out good resources and you won't see many results. So if there's a resource in there and it's not tagged to a specific city, then it's just not going to show up if you type that city in. Sometimes they are in there, and I know for some cities it's helpful. So you can try, but if you're not seeing results, clear that out and try again. The other two fields at the bottom there, languages and targeted demographics, I would also avoid using those for the same reason. If you select these filters, the search is only going to yield results that have specific values tagged to them, and most of our resources don't have languages or targeted demographic tagged to them. So it's not really a safe bet, and you're probably going to miss out on resources if you use those ones. Okay, and if all else fails, you are just not finding results for the resource that you're looking for, you're almost certain that there must be something in the directory and you're not seeing it, try searching for the resource try searching through the resource directory that's on our website. So again, this is the same as what is in C2C, and this search functionality is a little bit different and a little bit easier to use in some ways. So what I mean by that is there's this search field right here where you can type in a keyword and it's going to search all of the fields. So it's going to search category, service name, description, organization. It's going to search all of that. Whereas in C2C, if you type something in the service name field, it's only searching the service name. So you might be searching for a keyword that's just not in there and you're not finding any results. So the example that I had just pulled up, let's say your client is looking for a place to shower. So again, you don't know what the name of a service is. You're not really sure what you're looking for, but you're like, I just need to find something that offers showers. So this is a good way to do it. You can just take a look through the resource directory here and try to find something that you're looking for. You can see that they're shown by county, which you can also filter for. If you find something that looks like it would be a good fit and maybe something that you want to refer your client to, you can find what it is here. Now I have the name of the program. It's called Fresh Start Shower Program, and I know how to find it in C2C. So I could type it into the service name here, and now I'm able to find that resource. So the category was under other, so that would have been hard for me to find because there isn't a shower category. As a reminder, you can expand the resource and read more about it by clicking this little arrow right here. And yeah, that's a great way to find resources if it's just not happening in C2C. And then another thing that I would recommend, and I'll go into a little bit more detail about this in a second, but if you find that some resource or type of resource is specifically hard to find and then you finally tracked it down, I recommend saving a filter so it's easier to find next time. And the way that you can do that is just by clicking this button, Save Filter. So maybe I say Kitsap Shower Resource and save. And then the next time that I am in C2C and I know I need to find something like that, I can just open up my filter names. Here it is, and I can find it right away. Maybe there's a few results in there, but that's a great way to come back to something that maybe was particularly hard to find. All right, and so just to elaborate a little bit more on the saved filter functionality, it's actually a great tool for several different reasons. So one thing that we always recommend is that you save a filter with those two fields that I mentioned previously. So the community of health. So if you know that you're going to start every search that way, go ahead and save a filter, say OCH submitted, and now I have that one. Maybe you are a care coordinator with PCHS and you're constantly referring folks to PCHS resources and services. There we go. Maybe you want to just save that filter, and then you have it right here in your drop-down menu. So I can see all of these. If you have any favorite resources that you're using a lot, just save it as a filter. One of the features that we all agree would be really nice is to be able to save a list of favorite resources that you're accessing a lot. And unfortunately, because that isn't a filter, this is kind of a hacky way to do it. So if you find something that you're using a lot, just save it as a filter. As far as I know, you can save as many filters as you want. So this is a great way to just kind of create shortcuts for yourself when you're trying to locate resources. All right, which leads me to my last topic, which is documenting referrals to your client's profile. Okay, so you can do this in two different ways. One is if that resource and referrals task pops up as part of your workflow, you can select the call to action there. And the other way that you can do it at any time within the workflow, anytime with any client, is from the client's profile page. In the referral section, there's this button, New Referral. So in order to add the referral to the client's page, you need to do it this way rather than navigating to the resource directory from the link here on the left side. So we'll go New Referral, search for services, and then you'll get into this view of the resource directory. Pro tip number one is unselect this box. So for some reason, it defaults to this search. And again, it's going to look at the client's zip code and the zip code associated with the resource, which, as I mentioned, is not a very trusty way to filter. So we want to get rid of this right away, which is going to drastically improve our search results. So there's a few different things we're going to do here. Okay, so there's two different checkboxes here on the resources. So of course you could access your filters. Maybe I know I want to do my shower resource again. I can pull it up right here. Find the resource that I want, and I'll notice that there's two different checkboxes next to the resource. So the first one is select resource, which is just how I select the resource that I'm looking for. Obviously, if there are more results here, this is identifying the one that I actually want to send to the client. So there's a few things that I can do with this box. I could print it out, which will bring up the print window. If my client is sitting right next to me and maybe I just want to send them home with some information, I can email it. Just a note that as soon as you click this button, it just emails it right away to the email address that's on file for the client. So it's not even going to ask to confirm anything. It's just going to send it right away. So that's what that one does. And then the last thing is pinning the resource. Pinning the resource is a great way to just keep track of resources that maybe you want to discuss with your client in your next meeting together, or that you're currently talking about, but you don't necessarily want to refer them right away, or you haven't received their consent to refer them. So if you want to pin it, you could just click that. And then when you go back to the client's profile, I can now see it here in the pinned resources on the right side of the page. Okay, so then if I want to actually make a referral, I'm going to go back here again. And this time, let's select one of these ones. Get out of here. Okay, so let's say I have talked to my client about this resource, let's say dental services, and I want to actually make a referral. So I'm going to select the resource, and then there's also this additional box right here that you need to check in order to send the referral. So you can see the button is grayed out if I don't have that box checked. This is what you want to select when there is an intention to actually refer the client to the resource, either client-led or collaboratively, but you're planning to actually reach out to this resource. The reason there's a checkbox for consent here is because it is possible and will become increasingly more possible for you to be able to actually send a referral to the service provider selected through C2C. If and when this is the case, it will be really important to first confirm that this is something that the client actually wants and consents to. But right now, pretty much none of our referrals are actually going anywhere because the service providers are not using C2C to receive referrals. But again, that's something that we're hoping to change very soon. So if the client's like, yes, I would love to be referred to this service, that's when you check consent to refer and then you click send referrals. This box is always going to come up because, again, it's saying, are you sure that it's okay to send the referrals? But then there's a second warning at the bottom here that's telling me this service provider isn't actually receiving referrals on C2C, so this isn't going to go anywhere, and you're actually going to need to contact them, which I think many of you are familiar with how this works. So that's what this box right here is doing. You can say yes, and then I'll refresh it. And you can see that it showed up. It automatically pinned it for me. And then it's now here under referrals, and you can continue with the associated tasks as you normally would. All right, so that's it. I hope that this was helpful, and I just wanted to close out with a few resource directory resources. So first, we have a new FAQ document that you can access through Genius. There's a link there. Definitely be sure to bookmark that. It's a living document that we'll be updating regularly. And to start, I've included some of what I've covered today in this video on the resource directory. Would also recommend keeping an eye on our biweekly newsletter. There's a resource spotlight section that highlights valuable or new resources in the area. So that's a really great way to stay up to date. As always, if you have any issues, technical issues with the resource directory, you can visit the tracker and create an issue ticket so that we know what's going on and can work on getting it fixed for you. And then any other questions, as always, you can just email us at connect@olympic.ch.org. Thanks so much.